Hi, guys. Welcome to Chemo Glow, where the glow doesn't define me, I define the glow. Thank you for joining us tonight for our live Wear Your Good Clothes. And next week, we're going to have Susan Kinney, Dr. Susan Kinney. She will be on for Let's Chat. So we'll check her out next week. One of the other things that I want you guys to do is please check out our YouTube, Facebook, Twitter, Instagram, and share. Share, and make sure you subscribe. Also, check out our podcast where available. If you're interested in being on the show to share your glow, please email us at chemoglow@gmail.com. Tonight is going to be a good night because I decided to wear my good clothes. And we've been volunteering all month. All month, I've been interviewing volunteers such as myself. And what a way to end the month of Volunteer Month than with Janine Jones. Now, you guys, if you haven't listened to her podcast, please do. Why Am I Still Here? It is so important you hit that button, subscribe, listen to. I actually just fell in love with Janine when I met her. She is so amazing. She volunteers with me at UNC. We're on the PFAC committee, and out of the 19 subcommittees we have, she's on 11 of them. And if she could, she'd be on all 19. So just meeting her through Zoom meetings and seeing her do her work, it's been amazing. So her volunteering is so amazing. Now, I'm going to let her tell you a little bit about herself because she's a beast at everything that she does. Please welcome my guest, Janine Jones.
Hey guys. Hey, Regina.
How are you doing?
I am wonderful. How are you?
I'm good. I'm about to come out in my good clothes. It's hot. I just need a tank top on.
This is not that kind of show.
It's not that kind of show, right? But I swear all I need is a tank top on. This is ridiculous. I don't know why it's so hot here. So my hair starts to grow because this is all natural. Just keep going with it, okay? Because it might get a little bit
the grow and the glow, right?
There you go. Go ahead and introduce yourself to my audience.
Sure. My name is Janine Jones, and I am a 7-year non-Hodgkin's lymphoma survivor. Wow. And as Regina said, I volunteer with UNC as part of the reason is to give back to so many people who gave me so much and gave me my life back.
Yes. And you volunteer well. Like, I literally really started paying attention in the Zoom calls. You are like, or the Zoom meetings or web, whatever we're meeting at, you're so thoughtful when you're talking about the things that we need to work on. And I thought about you because you don't want a fluff piece. Like, what are we really doing? You know, what kind of quality are we putting out there? Are we having any impact on patient care? And at that time, I did not know your story. I just knew that, okay, she's amazing. She's doing amazing things. When I grow up, I want to be like her. So before we talk about you volunteering, just tell me a little bit about what you were doing before you were diagnosed.
So 2 things. I worked for a large hospital system. I'm a nurse by trade, but I kind of worked my way up and became in charge of patient safety, which is one of the reasons why I'm so passionate about what we're doing at UNC to make a difference. I'm not there for fluff. I'm there to get things done. Yes. I also was in the best shape of my life. I was a competitive CrossFit athlete. I loved to do all things physical, lifting the heaviest weight possible, in a happy marriage and just living the life.
Living the life. And I think we have some pictures of you, like, not playing at all. The heaviest weight. What's the heaviest that you can lift? You used to lift?
Oh, well, it depends on the type of lift, but I was almost at 300 pounds on my deadlift, and I'm 5'3", and I was about 120 pounds at the time.
Oh. I got 5 on you, like 5 pounds. But I actually used to really love lifting weights in my younger days. I really, just the adrenaline of it and just accomplishing things and then being in there with all the knuckleheads and like, yeah, I can do just as much as you can, if not more. But then I got hooked on spin class and you couldn't tell me anything after that. So being diagnosed, you were doing two things. You were a nurse by trade, and also you were not just doing CrossFit, you were winning.
Yes.
And what happened to make you say, hey, something's wrong?
I'd had a cough for 3 weeks and I thought, it's just allergies. I just really dismissed it. It was getting on my wife's nerves. She kept telling me to go to the doctor because I wouldn't stop coughing.
Mm-hmm.
But I really didn't think anything was wrong until I started not performing as well in my workouts. And one night in particular, I had already decided that I was going to go to the doctor and get my cough checked out. That night, I just hit the deck during a workout. It was a lot of jump roping and heavy lifting weights. And I felt like I had a fever.
Mm-hmm.
I thought maybe I have pneumonia. So I went to the doctor and she did a chest x-ray. And on the chest x-ray appeared a white circle about the size of a grapefruit. And she explained this to me and, told me, okay, you're going to need to get a CT scan. But at the time, I didn't equate that with cancer. I thought, well, something's wrong, but I don't know what it is. So the CT scan showed that it was either lymphoma and a number of other diseases that I was not familiar with. And because I worked at the hospital system where I had my CT scan, I was able to speak to the reading radiologist. And he said, do you have any history of lymphoma in your family? And I said, no, not that I know of. Now, I'm a pediatric nurse by trade, so I knew at the time nothing about cancer.
Mm-hmm.
I didn't know lymphoma meant cancer. I thought it meant tumor. And oh, well, if it's tumor, we'll get it taken out. Because again, best shape of my life. I ate healthy. I just, lived a very healthy lifestyle.
And with that, when you come in and not knowing, this might be cancer, what did they have to do after your, them finding the tumor and seeing what it is? What was next?
They had to do a biopsy
to
determine exactly what it was. But at the time, I had a doctor friend who was saying, this is very serious. But it wasn't until they did the biopsy that they knew specifically that it was very large B-cell non-Hodgkin's lymphoma. And a very aggressive type of lymphoma.
That's exactly what I'm about to say. Was it an aggressive type of lymphoma? And is that a good thing for it to be so aggressive?
With lymphoma, yes, it is. The more aggressive it is, the easier it is to treat.
Wow.
So that was the good news. But I will say, the way I found out that I had cancer was I get a phone call from my primary care provider, the doctor that did the chest x-ray. And she said to me on the phone, we were on our way to my best friend's wedding rehearsal. And she said, hey, this is Dr. So-and-so. I understand you've talked to the reading radiologist for your CT scan, because she knew, of course, that I worked at the hospital. And because I had an N, because I was who I was able to speak to the radiologist that read my scan. So I was very fortunate. And I said, yes, I have. And she said, well, I just want you to know that I've set you up with an appointment with Cancer Treatment Centers of America. I'm sorry, what? And I said, this is cancer? That was the first time I'd heard the word cancer. And I just broke down. I became very angry. My wife had to pull the car over. I didn't know what to think. This isn't fair. Why me? All the things that you go through. But I decided to pull it together for my best friend. I did tell her when I got to the wedding rehearsal what had just happened, because of course I was a mess.
Mm-hmm.
But I was determined to pull myself together and be there for her for the rehearsal. I mean, after all, the next day was her wedding. So I did. I here I had this big tumor in my chest, and it's cancer. But the next day I danced like a fool at her wedding, had the best time, and just really enjoyed her and celebrated her, because I knew, from that point forward that there was going to be a big journey. Right.
Once you hear those words, everything changes. And I'm going to go back to this picture right here, because on this date where you're presenting, you actually found out about it. And how many weeks did they tell you, if you don't take care of this, how long did they give you? What was your prognosis if you didn't take care of it?
Yeah, so pretty soon after the biopsy, and they found out what it was and how big it had gotten over a period of they estimate about 6 to 8 weeks. It had grown to that size. And the fact that it was pushing my lung towards my back, it was pushing my heart to the right side, and it was also pressing on my superior vena cava, which of course is, links the blood to the brain. They said, we need to admit you as soon as possible. You want to come in tonight or tomorrow? And I was like, okay, well, knowing hospitals, I'd rather come in the morning. Thank you very much.
Everybody's up, everybody's fresh, we're ready to go.
Exactly. So we get in there. I'm sorry, go ahead.
No, go ahead. You're about to answer my question. I know you are.
So we get into the hospital room, and the oncologist comes into the room, sits down. He was absolutely fantastic. He acted like he had all the time in the world and explained to me exactly what the diagnosis meant. And he actually gave me 3 printouts of 3 different clinical trials and the results. And he said, now, based on your particular situation, the size of the tumor, etc., I recommend this chemotherapy regimen, but ultimately it's up to you. So it is.
I have a choice.
Yeah. So it was extremely empowering as a patient, and for my wife, to know that we had a choice in this matter. And I did end up going with his recommendation because it had a 95% chance of a complete cure. But during that time when we're sitting there chatting, I said, I'm just curious, if I didn't treat this, how long would I have to live? I was just curious. I wanted to know the severity of the situation. And he said about 2 weeks.
Wow.
And it was at that time that I knew I was in for the fight of my life. And I had to make the decision right then and there. Okay, am I going to fight or am I not? And I decided to fight no matter what the outcome, and I had to make the decision at the time that, well, if it's my time to go, it's my time to go. And I had to be okay with that. And I did become okay with that. But in the meantime, I was there to fight with everything that I had.
And I was just about to ask you, what kind of patient were you? And you were there to fight, but you were also a happy cancer fighting.
I was. I was. Well, I don't know if happy, but positive.
Positive. Right? You were positive.
Was the right word.
Positive. You were better than me. And I appreciate that, to have someone so positive, because it taught me that if you go through it positive, it makes it so much, it makes it where you can bear it a little bit more, I should say, on those bad days when you have a positive attitude. And my husband was that positive person, which made me start to think that I need to turn this around, because anger was there, because how I was told that I had cancer, that's what made me angry. And going to a second hospital to be looked at again, and the way they told me, I felt like I was empowered and I had a choice. So it is so important that doctors do that. When they walk into the room, they're not just talking to you, they're talking to whoever's in the room with you. and they give you some of that back because everything has been taken away just by hearing those little words. So it's just so important how doctors walk in the room, how they tell you things, and how they engage with you, so you're part of the treatment.
Absolutely. I mean, it is your body, and it is ultimately your choice. I mean, you can either choose to treat it or to not treat it. You know, it is up to you. Should be.
Should be, right? It should be up to you. Now, what type of treatment did your type of cancer require?
So because it was so aggressive, it necessitated an aggressive set of medications. It's abbreviated REPOC, and it's a number of different chemotherapeutic agents along with prednisone. That's thrown in there too.
I hated prednisone. Oh, why not? Let's just throw this one in here. I had that and Benadryl because I kept breaking out every time I went through chemo.
Yes, and there was one particular chemotherapeutic agent, Rituxan, that I had a really bad fever with it, which was sort of expected as a side effect, and so I had to have Benadryl every time I took that. That was loads of fun because I became crazy with the IV Benadryl. My wife can attest to that.
I was like, I'm not touching any type of chemo until I get the Benadryl. And at one
There
point,
you go.
We'll go ahead and start the drip. No, you will not, because I don't want to have this foolish breakout on this floor. So I need you to give me my medicine before you give me my poison. So that's going to heal me, basically, because it does. You look at the side effects and you're thinking, okay, headache. Okay, this. Okay, that. Until it happens. And, and you had two different chemotherapies, right?
Well, there were about 4 or 5 chemotherapeutic agents that I had, not only through my port, but I had to have spinal chemo as well. So that's when they do a spinal tap and infuse the chemotherapy directly into your spine. And the reason for that is because with blood cancers, they tend to run and hide in your cerebral spinal fluid. So they want to put chemo in there too, to make sure that it kills it there as well.
Did you have any bone pain from that?
Oh, yes.
Yeah.
Oh, yes. A lot. But I will tell you, with my chemo regimen, they don't do this anymore. They've come a long way, thank goodness. But I had a total of 6 months worth of chemo. And at the time, I had to have a continuous infusion through my port for an entire week where I couldn't leave the hospital. I couldn't even leave the hospital floor where I was. It was really, really tough. And then it was 3 weeks at home. And then another week in the hospital, 3 weeks at home, etc., for a total of 6 cycles. And you mentioned poison. By the 6th cycle, I was up to here and feeling completely and totally toxic.
Yeah. I did not finish all my chemo treatment because it got to the point with the neuropathy, and my quality of life really went down. I could not zip up my pants or do anything. And so we went in, and again, we talk about choices.
Right.
And my doctor said, hey, you're over that hump. You're over that number. So if this is where we need to stop, this is where we need to stop. I just could not take any more. I was going to crawling. You would be sticking that thing in my chest. But my husband's like, yeah, we can't. You should see her. She can't do it. So having that choice is so important. You mentioned that you were on 5 days. 5 days. So how many treatments did you require? Which you just said. Go ahead and tell our audience member how many treatments you required.
So it was 6 total cycles of 1 week. So 6 total weeks over a span of 6 months of a continuous infusion of all of those different chemotherapeutic agents. And then one time during that stay, I would have the spinal infusion as well. Yeah. So the first couple of cycles, I was fine. I mean, I was still CrossFitting, of course, not to the level that I was, but as long as my white count was okay, then I was CrossFitting, and I worked the entire time. I went to work and kept going until towards the end when the chemo had built up, because that's what it does. It builds up just like it builds up in your system because it kills everything, which is what they want it to do, and bring your system back down to zero. Right? And that's what happened. And so my white count was so low because of risk of infection with it was either the fifth or sixth treatment that I couldn't go into work. And luckily I was able to work remotely.
Okay. And how often do you have to go for follow-ups? Well, we're about to answer that question, but before we answer that question, after your treatment of chemotherapy, what was next? Was that it? Or was there something else? Because you're in one of our lovely pictures that we have, you are halfway done, right?
Yeah.
So
yes.
During this time,
chemo number 3. Yeah.
Chemo number 3. Wow. Chemo number 3. So by chemo number 3, did you shave your head or did you allow it just to fall out itself?
Oh, girl, my hair before I did chemotherapy was amazing. I mean, my pompadour, it's a little shorter now, but not for chemo. But I got it cut. But I had the pompadour of all pompadours. And it started to fall out. And so I had a wonderful hairstylist at the time who actually came to my home and shaved my head preemptively. I didn't want to start pulling my hair out in clumps. So we shaved it.
Yeah.
And then of course and you could still see, my hair follicles, but by the time the chemo had, I guess, taken its wrath out on me, all the follicles were gone. So I was completely bald and my head was cold.
Oh my goodness. So cold. Right. I was like, this beanie hat, whatever. And I don't know about you, but chemo also gave me hot flashes afterwards. So I was hot, and then cold. And I was like, this is just ridiculous. And I wasn't a fan of wigs. So it was like, this is what it is. I put a wrap on this hair every once in a blue moon, but yeah, no.
Yeah, I wasn't about the wigs either. I was like, I am who I am. The only time I would wear a cap, my wife would knit me caps, was because my head was cold. That's the only reason I put anything on my head. Otherwise, I was like, I'm bald and proud. I'm fighting for my life. Let's do this. So, and that other picture where I'm in the wheelchair there, they had actually given me they were giving me a chemo break, and they let me go outside. And that was the last treatment that I was undergoing. That's when I was sickest.
Oh, I know that little circle that they let you go outside in. It gives you a break. I remember when I was going through treatment, I tried to sit over there on the bone marrow side, and I had no idea. They were like, absolutely not. You go over on this side. This is only for them. They're in here weeks at a time. I was like, I'm so sorry. I didn't know. I thought chemo floor was chemo floor, but it is not. And the fact that you have to spend 5 days in there, it's ridiculous. Now, one of our guests, one of our audience members said, what was your follow-up? So you had your actual chemotherapy, and what was next?
Yeah, so the follow-ups are graduated. So as you get better, you have less frequent follow-ups. So I think it was every 3 months to begin with, and then it went to every 6, and then it went to every year for 5 years. And every time I would go, they would draw my blood because there's a particular element in your blood called lactate dehydrogenase, or LDH, and that's an indicator for lymphoma. And so I would go, and every time I would just be sitting there, praying that LDH was normal, because when I had cancer, it was just out the roof. So I even made a spreadsheet to see, each time I went in and got my level checked, I watched it go down. It was a beautiful thing.
My husband made spreadsheets while I was going through treatment. Yeah.
Well, and I see that one of my friends is actually listening,
Yeah.
and she knows Christy, and Christy is all about the spreadsheets. She
Are
had
you
everything organized. Yeah.
are you talking about Beth?
Yes.
Yes. So Beth is listening, and she did say, "Hi there, Janine. Great interview."
I
Let
see
me tell
you. I
you.
see you.
Let me tell you. James and Tasha Dawkins, who's on here, who's asking all those wonderful questions too.
Yeah.
She's a nurse, and
Oh, wonderful.
she understands because she had to go with my husband and I when he broke his leg 7 days after the girls were born. Yeah, 7 days, and she got to see she got to see exactly how my husband is as a patient and as a caregiver. And
Let
the
me guess,
doctor
he's
was
a better
like,
caregiver.
he's a better caregiver. But the doctor was like, when the doctor walked past, his surgeon, he was like, "Hey, aren't you so-and-so? And you did this procedure and that procedure." And he was like, "Have you been looking me up?" He's like, "Yeah." And I was like, "Oh, he's one of those." And he has a spreadsheet on when he's going to get better and when he can get back on his bike. So
Awesome.
I'm sure your wife and my husband will get along just fine.
Definitely. They can share war stories for sure. That's the thing. In my opinion, it's easier to be the cancer patient than it is to be the caregiver, caretaker of a cancer patient. Because at least as the patient, you're doing something, right? You're actively undergoing the treatment, but your caregiver, your spouse, your partner, they're helpless,
Yeah.
And that was one of the things in the hospital, actually. The nurses, of course, got to know us really well, and they knew Christy needed things to do. So they would come in, and Christy would be looking for something to do. I said, "Well, you want to fill her water pitcher?" And Christy's like, "Yeah, I'll do that." And then Christy's like, "I'll change your bed sheets." So that's another thing. Not only should physicians and nurses empower the patient, but also empower the caregivers, at least that are willing to help out. Yeah.
That is so true. When we used to go into the hospital, the one time that I finally convinced them I could go by myself, they said, "Where is he?" I'm like, "But I'm the patient." But they were ready for him. And in my chart, it had a little note that says he is very involved in her treatment. That's a nice way of saying, "Here he comes."
Oh,
here he comes. He wanted to make sure. But we had a question over here by Mikey Lido. Have you gone back to doing CrossFit at all?
Good question. I get the question a lot, actually. Yes, I went back right after when I could, when my energy was up, when my levels were good. But I had more of a passion for lifting heavy weights. I actually got into powerlifting through CrossFit. So deadlifts, bench press, and I've already forgotten the other one. What's the other? Anyway, they're power lifts. You're just trying to lift as much weight as possible. And part of that is, I think part of it was just still the fight in me. And I just wanted to prove that I was coming back. And so I did that. I competed. I won. And then I was done with that for a while.
What's next?
And then I got into just body weight exercises. We have a Nordic track incline trainer with iFit, and I love doing those workouts around the world. And so I'm a bit more, I guess, moderate in my intensity now than I used to be. But still love to exercise, love to eat healthy. Yeah.
Well, we just bought a rower like this week, and now we're just
nice.
Yes. So my husband's on that in the middle of the night, just go. And I'm like, okay, let's see who is chiming in now. Could this be your wife?
It definitely is. Squat. Thank you, honey.
Don't you love it? She was awesome.
bench press, yes, and CrossFit is insane. Yes, it is. Right. In fact, I credit CrossFit with getting me into this shape that helped me fight as well as I did, and I think that's one of the reasons that I did as well as I did. Yeah,
That was my
because
next
that
question.
chemo regimen was no joke.
Oh
It
my
was no joke.
goodness. It literally has to almost bring you to your knees, which it does. And like so close to death that you feel like, oh my goodness, am I not gonna wake up tomorrow? And right before I went into all this crazy stuff, we were growing on vegetables, we had like all these gardens, we're doing all this stuff. I'm, crazy about this Peloton, like killing it. And he's mountain biking, and then you're like, bam. And
Yep.
I knew that I had to get back to exercising in some way, shape, or form, or I'm not going to be any good. And it really helped me mentally too. Like,
Yes.
what did you do for your mental?
Oh, well, so that's the other side of the story. That's,
Mm-hmm.
during cancer, I was the most positive cancer patient you've ever seen in your life.
Mm-hmm.
And some people thought that I was, I don't know, faking it or whatever, but it's true. I mean, I was positive because I was alive,
Mm-hmm.
because I knew I had 2 weeks if I didn't treat it. I was just excited to be alive and excited about the prospect that I could live, right?
Mm-hmm.
But afterward, which is something that no one prepares you adequately for, is reentry. I
Yeah.
call it reentry into your life. A lot of people assume, okay, you beat cancer.
Mm-hmm.
Welcome back. Good to have you back. You're
You're
going
only
back to
gone
doing
for
your
six,
thing.
7 months.
Yeah, no, it
Not
doesn't
true.
work like that, because then everybody's situation, everybody's experience with cancer is different, even if you have the
Mm-hmm.
same type of cancer. With me, I didn't know how to go back to my old life,
Yeah.
my pre-cancer life, because my life had been threatened and I was forever changed after that. So I felt lost.
Mm-hmm.
I didn't know why I had been spared, why I was still alive. Um, I and at the time, just before I was diagnosed with cancer, I had made the decision that I wanted to change jobs because
Mm.
I became frustrated with the slow pace of change in healthcare. So I wanted to just pivot to something else. So there was that. I was also lost career wise. So yeah, I became depressed, and
Mm-hmm.
it was tough for a very long time. I did go to therapy. I tried some support groups,
Yeah.
but it was right after I finished treatment, and I was still in the glow, if you
Yes.
will,
Yeah.
of beating cancer.
Mm-hmm.
So when I went and I saw these sad older people in these support groups, it was not helpful for
Exactly.
me. And you had the same type of experience,
Yeah.
right?
It's not helpful when you go. First one, no one's your age. No one
Right.
looks like me. We're at different stages in our lives. And I was like, it made me feel worse. Like,
Yeah.
I'm like, this is not working for me at all. And I don't, and then even going to some support group where everyone's crying and everyone's going through. And I was just at a different stage. So you have to find the right thing for you, whether it's counseling, whether it's let me jump back on it and get back into it the way I know how. Because I hate the word new normal, because guess what? The new normal sucks. Sucks
Yeah,
it.
it
Like
does.
every time there was like new normal, I said, please take that out your little spill, because it's not the new normal.
No.
Now, like I like how you say reentry, because everybody's life is still moving. Everybody's life has gone on in those 6 months that you were going through, but it's not just 6 months. It is years after. I'm 10 years out and I'm still feeling the effects of it. You're
Yes.
7 years out, you still feel the effects of those things.
Yes.
So that takes a lot out of you. People who complete cancer treatment should be immediately, yes, where's my money? I need to
Right?
win the lottery.
I
Your
beat
Lord,
cancer. I should be rich
so
now.
much back to doing dishes in the laundry. It is so true. And that's why I loved at the end of your podcast, you said, like, wear your good clothes, go to different places. I like, we can do whatever we want to. I earn this S on my chest. I'm a superwoman. I'm doing it all. Call me what you want, but wear your good clothes. That's what
Yes.
we need to do. So,
Yes.
yeah, you gave me that idea, and it just reminded me of what my mom used to say. Be your best, do your best, just do it well.
Absolutely. And with the wear your good clothes, I'm notorious for, well, I need to keep, these shirts nice because I might need them for work and
That's
whatever.
right.
I'll just buy new ones. Why am I doing this? Right. And it's I think, with cancer patients, survivors, now we know, we faced our mortality,
Yeah.
stared it down, right? And so we also have in reentry, we have to strike this balance between, YOLO, you only live once,
Yeah.
and preparing for the future, right?
Exactly.
Because it's like my wife said, we should win the lottery, so then we can just go and do whatever we want to do whenever we want to do it.
Yes.
But we're not we're not all that lucky, to be, financially independent. So
Mm-hmm.
the balance has to come in of enjoying life and spending money on doing fun things and also preparing for the future.
Mm-hmm.
But it's hard because I struggle still sometimes, with the existential crisis. Okay, well, I've learned how short life is.
Mm-hmm.
So what do I do? What do I want to make sure that I do? So that can be challenging as well.
And Beth, your friend says, I love it, Becky, and I live by the motto, don't wait for tomorrow. It is never promised. It's
That's
never
exactly right.
promised. And having those hard conversations with your spouse, with your loved ones, have them, get them over with so you can move forward. Like, really, it's something that we really need to start doing with ourselves so we can live a good life. And
Exactly.
I'm glad that we're actually talking about this because a lot of people are scared to live good. Wear your good clothes. My husband, we would go out and I was like, put on the nice shirt. He said, but what if I get something on it? So what are you going to wear it in the closet? Like, do you want to just wear it in the closet and drink water? So I get it. And sooner or later, you start to think about the quality of life, right? What is going
Yeah.
on with the quality of life? What's more important? What's important to you? Goodness, we
Yes.
have a lot of comments
Absolutely.
up here. And yes,
I love it.
when a life-changing episode occurs, you realize life is short and enjoy each day like it's your last.
Yes.
And even with like me having my girls and you having your girl, how was
Yes,
that for
you want to
you?
show my girl.
Yes, I am. Look, I'm gonna beat my producer to it. I'm gonna put it on. Look at
Yeah.
that. Oh my goodness. What day was this? What
Well,
day?
that was day one there on the left. And I think she was about 4 or 5 months there in the other picture.
And how far out of treatment were you? From
Oh gosh. It was, well, so we got pregnant in when was it, honey?
I love it.
Yeah, it was less than a month after I was declared cured. We'd been trying to have a baby before I was diagnosed.
Uh-huh.
And then when they gave me the all clear, we said, all right, let's try again. And boom, there she was.
5 years later after being in treatment?
No, a month.
A month. Wait a minute.
A month. We got pregnant a month after I completed radiation, actually.
Oh.
So she was born in 2015, July of
Uh-huh.
2015. And yeah, so she'll be 6 this year.
6. Oh my goodness, you have a 6-year. I envy you. Mine's a 4. Well, there'll be 5 in June. They're right behind.
Yeah,
COVID has made it where I missed a year somewhere.
right.
Like, how are your kids? I don't know.
Right.
19, who knows? But going through this, having 6 going on 26, absolutely. Absolutely.
Yes.
Yeah.
Yes, she is. Definitely. She's a
She's definitely gonna
teenager.
have to come and hang with my girls because, yeah, I think they're 21. They turn 21 in June. That's where
Well,
they're
they'll
at.
get along famously.
So going through treatment, we talked about chemo, and you just mentioned radiation. How
Yes.
much radiation did you have to do?
A month's worth. So every business day for a month, I went to UNC and I got zapped and
Mhm.
I went back to work. And radiation was a breeze in the sense
Mhm.
that I didn't have the side effects that I did with chemotherapy. But it was frightening,
Mhm.
and for two reasons. One, they had me bolted. They made a mask for my face and they bolted me literally to the table.
Oh wow.
And they put little tattoos on you so they know
Mhm.
exactly where the radiation beam should go. And I had it directly to my chest. Because after the chemo, there was a little bit of life still left in the tumor. It was the size of a skittle, I think, at that time, or a little smaller, after being grapefruit size. So the chemo had worked really well. And they actually told me, they said, you've got a choice. You can let the chemotherapy continue to work over the next few months, or you can do radiation and obliterate it. And I said, obliterate it. Take care of it. Get rid of
All
it.
of them.
Now we know, and it's amazing how quickly our knowledge is expanding on treatment of various cancers. And now, knowing what we know, I would not have needed radiation based on the scoring and what they've learned since, which is kind of a bummer
Yeah.
because as a result of radiation, not only am I at increased risk for breast cancer, but also it put me into hypothyroidism.
Mm.
So that's been a lot of fun.
Yes. That happened to me afterwards, and I'm like, so on top of beating cancer, now you telling me I have to go here and do this. It's ridiculous. It's
Yeah,
like the
I
side
know these
effects of
mammograms.
all kinds of things. So your wife? No,
It's
no.
Heather. Hey,
This
Heather.
Heather. Is this your wife's sister?
Yes,
Yes, yes.
my
Awesome, right?
awesome sister-in-law.
Oh, I love it. I love family. Tell me how your family, how did they react to you going through treatment?
Oh, well, we've already talked about my wife and her unwavering support
Yeah.
during the whole thing. Um, they were fantastic. I mean, my family, my friends, everyone was there for me. Um, just unconditional support. They were
Okay.
fantastic. Even my best friend and her, let's see, yeah, her then husband, new husband,
Uh-huh.
would come every Friday when I was in the hospital for a date night, and they would bring
Oh,
food. And yeah, I don't know how people do it, how cancer patients do it that don't have support. I really don't, because it was extremely tough with all of that support.
yeah. Well, Erica Mack, who's another nurse, I have a lot of nurses that join me. How did you adapt to being in the patient role versus the nurse caregiver role?
Oh, fantastic. Thank you for asking that question. Well, it was tough, right? Going from being on one side of the bed rails to the other side of the bed rails.
Mm,
I knew way too much.
mhm.
Especially when it comes to patient safety and the potential for medical errors. So,
'Cause that was your
just to give
job,
you an
right?
example, when it, well, yeah, yeah, and medical errors are a result of process problems, right? Not
Mhm,
people problems.
mhm.
But I know that one of the risky processes in the hospital is having your blood drawn and potentially mislabeled, right? Labeled with another patient's label. So every time they came to draw my blood, I asked to see, once they'd put the label on it, I asked to see every single tube to make sure that was mine.
Mm-hmm.
And there was only one phlebotomist that got a little huffy with me, because she had the unlabeled tubes of blood in her hand and was walking out the door. And I said, well, where are you going? Where are you going? Do you mind labeling those in the room where I can see? She got a little upset with me. It wasn't that I was questioning her ability. I just know it's a risky process.
And you should advocate for your
go ahead.
care.
I'm sorry?
Advocating for your care is so important.
Yes. And most of the nurses, well, almost all of the nurses at UNC said, thank you. Thank you for helping me keep you safe.
Wow. That is so great, because I have lymphedema on my left arm. They clearly wrote no needle pricks, no blood pressure, no nothing on this arm. In the middle of the night, have to come and wake you up. And sure enough, what do I feel? Somebody trying to put something on his arm. My husband was livid and said that person better not step foot back into his wife's room, because it's on the door, it's above my bed, and it's on the arm. Like, did you just think the writing on my arm was graffiti? Like I was in here just writing on myself? There's a reason for it. So advocate for the care. And now we have another question from Erica. Did this experience make you change your practice? So what do you mean by it? Make you change your practice?
I'm assuming she means as a nurse.
As a nurse, yes. And that's what's next. So tell us what you're doing now that you've changed from being a nurse. Where are you at now?
So I had not practiced as a nurse for many years because I was administrative in the field of patient safety in the Department of Patient. So I was in charge of patient safety for our hospital system. So now I'm in clinical trial software. It was very fortuitous. A friend said, "Hey, are you interested in this job?" And it was being a customer success manager for sponsors, just for example, Johnson & Johnson or Merck or Pfizer, who we're all familiar with now because of the COVID vaccine. And, helping them out with their clinical trial software. And it's been a wonderful journey. And I'm very passionate about it because I am alive because of a clinical trial. And to play one little bitty part in clinical trials, and to be able to smile when I see my company win awards for studies about lymphoma, where they're studying various treatments, especially immunotherapy. Get rid of this chemo. It makes me smile, and I absolutely love it. It's a fantastic fit for me. There are times when I miss nursing, though.
Yeah, but the fact that you were practicing a nurse by trade, and then you went into the quality of the practice of, like you said, it's the process where people get hurt at if we're not paying attention to quality care, quality customer service. And now you're sitting here and you're having impact on actually clinical trials. And like you said, get rid of this chemo. Oh, get rid of this chemo. It's
old. It's so old. And I don't know, the listeners out there, chemo was actually discovered. It was discovered that chemo worked when a patient died in a clinical trial for chemo, but they did the autopsy and found that her cancer was gone, or I don't know if it was man or woman, but they were like, the chemo worked, but we gave too much.
A little bit less of this red devil. That's what they used to call it for me. It was called the red devil. And the nurse would come in and she would have on a whole protective suit and was like, and I'm like, why are you wearing that? She's like, oh, I can't touch this. Oh, but you're about to slide this in my port? Oh, thank you.
Right.
I appreciate that. That makes me feel so good. Did you ever have a clog in your port?
No, thank
Oh, they
goodness.
like bring the Drano. I'm like Drano. I'm gonna need you to use the technical term because I don't like the word Drano because it sounds like you're trying to kill me here. But it's crazy that we can laugh about it now and we still feel the side effects later. But we're so blessed to be on the other side of this, right? 5 years, you were declared cured. You're 7 years out. You're wearing your good clothes. You're eating on the good china. What's next for you?
Oh man. Well, due to come on, being on the other side of COVID and being vaccinated, I can't wait to travel. So
Yeah.
we have several trips planned. I'm part of my job is I get to travel, and I absolutely love it. And I'm a very social person, so it's been extremely difficult for me to be in my home and not talking to people in person. So looking forward to that. In terms of career, I'm oh my mother-in-law wants another grandchild. No, not gonna happen.
Are you done? Because I'm done. My husband said he's good.
We're one and done. One and done this time.
One and done. That's how I feel. You were lucky you got those two. One and done. We're done.
Yeah. I think just living my best life with my family and with my friends, and I feel much more relaxed as a human being, if that makes sense.
Yes, because I'm there.
Just relaxed and enjoying people and learning about people and places, and I just want to experience everything. Now, that being said, it's not that I don't have my down days or my down weeks, which is why I have a therapist that's on call whenever I need to see her, because it comes in waves, right? And anytime your life is threatened and you've been through something that was so intense and that changed your life irreparably, but beautifully, and you're going to have ups and downs. But I have more ups than downs, and a lot of that is due to my fantastic wife and my family.
Oh, now before we leave this podcast, one of the big reasons, besides you just being awesome, I wanted to have you on because your impact for the Patient Family Advisory Council. You won an award, but you were at the beach chilling where I would have been.
That's right. I told Loretta, no, I'm not taking any meetings. I'm at the beach.
But for being one of the volunteers of the quarter, because you do so much, how hard was it for you to step back in a hospital after going through what you're going through and deciding that this was going to be your give back?
That's a great question, Regina. It was extremely difficult. I would call Christy on my way in, and because I would be close to having a panic attack. It was, I literally I did have PTSD from one thing in particular, which was a bit odd, but it was from the blood transfusion that I had. I think just, again, knowing too much about healthcare and also being a little upset that I couldn't fight it on my own. I had to have blood from someone else to fight it. Kind of made me mad. But it was hard. And also the smell. When you walk in a hospital, there's always a smell. It's not a bad smell. It's just the smell of the hospital.
It's a hospital smell, yeah.
And it's only been, it was just before COVID hit, when we were still going to the hospital for meetings, that I was okay with walking through those doors, because I know the control, I'm not there for therapy, and I'm cured, and I'm there on a mission, and that's to help the hospital, help cancer patients, help caregivers, help doctors, help nurses. So I'm very focused now, but it took a few years to be okay with that. Yeah, and there was a while there where I thought I would quit because it was just so hard to go back in the hospital.
I'm so glad that you didn't quit us, because you are on 11 11 subcommittees on top of the committee. Like when I had, because I nominated you, well, I said, no, she's getting it.
Thank you.
Because I looked at how much you were doing and just a couple of the things that you've been working on that you've seen through. What are some things that you've worked on with UNC PFAC Council?
Oh, well, I did something today, actually. There's a physician quality and safety group. It's actually a part of the curriculum for new physicians at UNC. And I go and present my story, and I give them takeaways from the patient perspective about how to empower your patients, how to engage your patients, how to talk to patients. So I just did that presentation today. I also talked to nurses. There's an oncology core program for both new nurses and for nurses transitioning to the oncology area. I tell them my story. Also working on the parking committee.
That's
with
big.
you, Regina.
That's a big one where we're helping people not have to pay for parking on top of going through cancer and cancer treatment. And since we know they're not going to win the lottery at the end,
right,
the least we can do is make sure that they don't have to put that on top of everything else. Because just think, 5 days, 6 months. You know?
Yeah, and actually the nurses told Christy just to lose her ticket.
Yep.
Because then you only had to pay, what was it? You only had to pay for 1 day.
1 day.
As opposed to 5 days. Yeah.
5 days.
But you know what? We're lucky because we could afford that. But so many cancer patients can't. And so some of them will choose not to go to therapy because they can't afford to park there. So
exactly. That's Loretta at the top. She's amazing. And then there's some that are no longer with us that they have advocated. They have done so much. They actually used the worst picture of me on here because I had to leave early. We're right beside each other.
Oh,
that was for an interview I did years ago, and I was like, that is horrible, but okay. That's what happens when you don't send them a picture. They'll use what they have.
That's right.
Because I've enjoyed being the vice president of it, and I hope somebody else will take it on because I'm going to nominate someone.
This full-time gig that I do gets in the way of my PFAC work, man.
There you go. And I'm enjoying PFAC, but I think I want to be in the background just a little bit. It's a 2-year commitment, and on that last year, we're in the last year.
And you've been amazing.
Oh, well, thank you so much. We're at the top of the hour, but I want to see if there's any more questions or anything that I missed, and I don't think I did. Would you say volunteering has definitely given something back to you?
Yes, absolutely. In fact, one of the things that I needed after cancer was a way to give back, to give me a sense of purpose. It's one of the reasons I feel like I'm still here. It's one of the many. Is to give back to the hospital, the doctors, the researchers, the nurses who saved my life. You know, it's the least I can do.
The least you can do, and you do so much more. Is there anything you would like to say to our audience before we sign off? You've said so much. Wear your good clothes.
Yeah, wear your good clothes. And it is very true. You don't know if you're going to have tomorrow. So, tell people you love them. Pick a person every day. I'm actually starting to do this, picking a person every day and reaching out and just tell them I'm thinking about them and I love them.
Wow. That's going to be my challenge.
Be grateful for every single day that you have, because we don't know how long we have. And listen, I appreciate all of you guys that are listening. Thank you for all your support for Regina's program. She's amazing. And thank you, Regina, for having me on. It's been a pleasure.
Thank you so much. Hang in the backstage, and I'm going to check on you in a minute. But guys, I'm going to go ahead and close this out. This was amazing. This was a great interview. Wait to end a month of April when we're talking about volunteering and giving back. Let's make sure we continue to do that. Let's try the Jones effect, because her last name's Jones, so I'm throwing that in there. For the next 30 days, why don't you just pick up the phone and reach out to someone? Reach out to them. Tell them you're thinking about them. 30 days. 30 days. And when you do it, can you hit me up on Chemo Go and let me know that it's been done? 30 days. That's all I'm asking. And next week, guys, Dr. Susan Kinney, she's going to be in the building. I cannot wait to have her on. She is actually the director of breast health for UNC Rex. So I am so happy to have her on for next week. Just remember that the glow doesn't define me. I define the glow. And my hair did grow during this podcast. Lord Jesus, look at that. Bye, guys.